Hello everybody, welcome to our presentation. Today we're going to be talking about the Philippines and the global health challenge of diabetes. Our group consists of Firdaus Hasham, Joseph Mai, Ivy Diep, Michael Banh, and Reiner Regala. Thank you for taking your time to listen.
Philippines is an archipelago in the Southeast Asia region with a population of 116.6 million as of 2021. According to Diep et al., it is one of the most populous country in the world which comprise of Christian Malays, Roman Catholics, and Muslims. The country is divided into 17 administrative regions served by subnational or regional offices of different departments. Each region is home to provinces and independent component cities located in different island groups. There are about 170 languages in the Philippines archipelago spoken by the respective Filipino ethno-linguistic groupings. The life expectancy in the Philippines is reflective of the improving living condition in recent years, with male life expectancy at 68 years and female life expectancy at 76 years. Now let's talk about the Philippines healthcare system in the next slide. According to Diep et al., the Philippine healthcare service delivery is through a dual system composed of public sector and a private sector. The public sector is largely financed through a tax-based budgeting system where health services are delivered by government facilities under the national and local government. The private sector is market-oriented where healthcare delivery is generally paid for at the point of service. In 1991, the Philippines adopted a decentralized health governance which is financed by the local government units. And in 1995, the PhilHealth was developed and is the current social health insurance program in the Philippines, and it can be found in both public and private facilities. The PhilHealth covers services that are mainly focused on inpatient care and inadequate outpatient care that only covers the poor members of PhilHealth. What I mean by poor member is individuals or family that don't have a stable source of income to rely on to pay their healthcare expenses.
According to Data in 2018, these are the listed healthcare challenges in the Philippines that are prevalent and require healthcare interventions. The main healthcare challenges in the Philippines include tuberculosis, pneumonia, and natural disasters. In the following slides, we will elaborate about the prevalence of these complications and how it is being handled in the Philippines.
So our first health challenge is tuberculosis, and it accounts for 3.5% of the total disability adjusted life years, or DALYs, in the Philippines. One-fifth of the patients in a study by Orr et al. In 2000 had only sought help from a health facility after enduring 3 months of initial symptoms, and this often involved a private doctor. This means that people would rather deal with their symptoms than even seek help from someone that they may think would provide subpar care. Some major barriers with tuberculosis as a health challenge include ambiguous symptoms, association of tuberculosis itself with lifestyle or habits, stigma, financial burden, and visibility of care in public sector facilities. The history of tuberculosis and how costly it can be to every aspect in a person's life makes it just as deadly as any other chronic disease, but is often disregarded in many high-income countries.
The second healthcare challenge is pneumonia. GBD Compare has shown that lower respiratory infections such as pneumonia accounts for 5.95% of the total dailies in the Philippines. Furthermore, Lupison et al. Has stated that although there is significant research on community-acquired pneumonia (CAP) in Western countries, these CAP treatment guidelines may not be applicable to developing countries in Asia like the Philippines. Therefore, this presents a challenge for Filipino healthcare workers who already face limitations regarding resource and equipment availability. In a study conducted by Kosei et al., they found that children under 5 years old are at an increased risk of developing pneumonia, and adults who have low socioeconomic statuses, history of asthma, and/or have longer travel time to healthcare facilities. Therefore, poor socioeconomic status, coupled with poor living environments and a lack of healthcare accessibility due to geographic location, leads to limited medical care.
So the photograph on this slide was taken on September 28, 2021 at Florida Blanca Doctor Hospital Incorporated, and it depicts the PhilHealth coverage for pneumonia related to COVID-19. The prices range from mild to critical pneumonia treatments, starting from approximately 44,000 pesos to 786,000 pesos respectively. This is equivalent to about 1,100 to almost 20,000 Canadian dollars of coverage covered by PhilHealth. It is evident that pneumonia at any stage stemming from COVID-19 is taken seriously in the Philippines, and its coverage allows people to put their faith in the public healthcare system.
Health challenge number 3, natural and human-induced disasters. According to Luna in 2001, the Philippines is very vulnerable to natural disasters because of its natural setting, as well as its socio-economic, political, and environmental context, especially its widespread poverty. A study conducted by Labrougue et al. In 2016 has examined the perceived level of disaster preparedness in Philippine nurses. 200 nurses were invited to study, and the data collection was based on interviews using a standardized instrument, which was the Disasters Preparedness Questionnaire. Results show that more than half of the respondents, which was 57.7%, were not aware of existing protocols of disaster management in the workplace. There are also courses such as the First Aid Program and the Basic Life Support, which was cited as being very important for preparing for the disasters. Conclusions show that nurses in the study are not sufficiently prepared for disasters, nor were they aware of disaster management protocols in the workplace. For the clinical relevance, hospital administrators should consider the development and formulation of disaster management protocols and provide appropriate disaster nursing education and training. Nursing curriculum should focus on the basic principles of disaster management into nursing courses as a framework for addressing important topics when disasters manifest.
Although great progress has been made, there are still numerous issues in the healthcare sector that must be addressed. According to Diep et al., the WHO refers to the Filipino healthcare system as fragmented. There is a history of unfair and unequal access to health services that significantly affects the poor. The government spends little money on the program, which causes high out-of-pocket spending and further widens the gap between rich and poor. Healthcare in the Philippines also suffer from a shortage of human medical resources, especially doctors. This makes the system run slower and less efficiently. Only 30% of health professionals employed by the government address the health needs of the majority. Healthcare in the Philippines suffer because the remaining 70% of health professionals work in the more expensive privately run sectors or seek job opportunities in other countries.
Throughout our research, we found it helpful to contact a person who is residing in the Philippines to get a better understanding of their healthcare system. Please watch the video as we ask the citizens of the Philippines with the following questions, which include: what are the current problems with PhilHealth, and how do they impact the health needs of Filipino citizens? How manageable is diabetes in regards to the prices of insulin, healthy food options, etc.? If you are covered by PhilHealth versus other private insurances, what is your perception on public hospitals versus private hospitals in the Philippines? We will now be playing the interview.
Hi, my name is Reiner. I'm a fourth-year nursing student at York University. Could you please tell us about yourself?
Hi, my name is Fen. I live in the Philippines. I am 24 years old and I work as a freelancer.
Thank you. Is it okay if we record this interview for our presentation?
Yes, of course.
Perfect. So for our first question, what are the current problems with PhilHealth and how do they impact the health needs of Filipino citizens?
Issues and problems and corruption is prevalent in PhilHealth, so it affects the just issuances of health coverage to Filipinos afflicted with sickness.
Could you please elaborate on that?
Since most of the fund is getting stolen by officials in PhilHealth for their personal use, Filipinos who want to claim their benefits from PhilHealth can only receive little amounts of money because sometimes the fund is nowhere to be found or the fund is limited because it has already been stolen or used by the officials for their personal matters or for their personal use.
Thank you. For the second question, how manageable is diabetes in regards to the prices of insulin? healthy food option if you are covered by PhilHealth or other private insurances?
So for private insurances, it depends on the policy that you availed. So it's different per company and per policy. So those who can afford such policies can enjoy their benefits a little better, because I think in PhilHealth, they don't offer that kind of service or benefit. You can only use PhilHealth when you get admitted to the hospital. You can use it to cover some of the bill that you have, some amount of the bill or from the bill that you have. And also as an outpatient, I think you can use it. But if you want to buy medicine for diabetes, you won't be able to use PhilHealth to cover some of the amount that you want to use for that.
So
Mhm.
So PhilHealth only covers like hospital bills, but doesn't cover like medicine.
Yes, that's correct. So diabetes is more manageable for those who can afford to sustain their insulin medication, or those who can enjoy healthy food options.
Mhm.
But for below minimum wage earners, they usually resort to herbal medicine, locally concocted or by themselves alone,
I see.
because they can only enjoy that which they can afford due to their meager means.
Okay. Okay. Thank you for your answer. Lastly, what is your perception on public hospital versus private hospital in the Philippines?
The government is doing okay in providing or addressing the public health services that we have. But since corruption is present in any government agency in the Philippines, sometimes it's not enough. And private hospitals can offer a lot more and better facilities or better services than public hospitals. But those can only be enjoyed by people who can afford it.
Mhm.
For public hospitals, they are usually congested with patients, so you will have to wait for long queues before getting the service that you need.
I see. Thank you for your time today. We appreciate the information that you provided us to get a better understanding of the health-related inquiries about the Philippines.
You're welcome. Have a good day.
You too. Thank you.
According to Finucane and Macmillan, lifestyle of most Filipino people is mostly the common cause why diabetes is prevalent in the Philippines. They have less control in eating food rich in carbohydrates and calories, especially rice, since it is the staple food present in their tables from breakfast to dinner. Rice is a significant part of the Filipino culture, and it is difficult to reduce rice from their diet, as this may be perceived as an insult to Filipino culture.
Healthcare priority number one, improving healthcare and resource accessibility. One of the significant barriers is location. Rural residents often experience obstacles to healthcare, limiting their ability to healthcare services. Sufficient healthcare access in these zones require necessary, appropriate, and timely services. The distance to healthcare centers is another impediment in rural areas. According to a study by Silvano in 2018, the inadequacies for the access of healthcare facilities have reduced the life expectancy of rural inhabitants and increased infant mortality rates. Other factors affecting the administration of proper healthcare in rural areas include low population density, isolation, and fewer economic and workforce resources. In the Philippines, senior citizens are heavily consumers of the healthcare facilities from out-of-pocket cost, and they are considered heavily users in the medical centers, hospitals, and non-hospital health institutions. However, this group of population often has decreased accessibility and utilization of healthcare services that specializes in geriatric care.
The second healthcare priority is to make PhilHealth truly free and universal for all Filipino citizens. It is important to note that there are barriers that make this difficult, and these include the burden on taxpayers and decreased quality/variety of care. Taxpayers may not want to pay taxes that would only benefit others. They would only want to spend their money on their own healthcare, which they could find in the private sector where there is higher quality of care available due to the facilities having higher budgets. According to Oberman AL, the Philippine government has been actively attempting to improve the PhilHealth system since it was implemented in 1995, but their efforts have been somewhat fruitless as many Filipino individuals still experience poor quality of care despite the country's total healthcare spending being on par with their neighboring countries. Oberman AL further states that the insurance claim system of PhilHealth is unreliable and confusing, as oftentimes many individuals do not even know how to make a claim in the first place, as there are no readily available resources for them to learn how to.
The third healthcare priority involves staff availability, specifically in the public sector. Some barriers to staffing include the highly understaffed and overworked healthcare providers in healthcare settings. There is also considerable overcrowding in public hospitals. The Philippines is a major exporter of healthcare workers. However, they subsequently fail to ensure sufficient healthcare worker availability in their own country. In addition, maldistribution of healthcare infrastructure and resources is a widespread issue across the country, as only the major cities like Manila often get the spotlight. Public facilities in the Philippines are often incorrectly perceived as overcrowded, inefficient, understaffed, and short of medications, while they believe private care is convenient with better care offered. Hospital-based ambulatory care is traditionally provided in large overcrowded outpatient departments with long lines, very short consultation times with the doctor, and unsatisfied patients.
The implications of the COVID-19 pandemic in the Philippines. According to the World Health Organization, there have been 9.7 million confirmed cases and 130,000 confirmed deaths thus far. In a study conducted by HAPAL, he found that the government's quick and draconian-style response had led the country to heavily rely on the authorities to maintain order. Lastly, Agatan and Suto have found that the Philippines suffered greatly in terms of the impact COVID-19 had on its e-learning programs, with the most significant problems including poor connectivity and poor support for their learners and teachers.
It is important to understand what is diabetes mellitus. According to Lewis et al. In 2018, diabetes mellitus is the abnormal amount of insulin or its ineffective utilization. There are two types of diabetes, which include type 1 and type 2. Type 1 diabetes mellitus is a destruction of pancreatic beta cells through genetics, while type 2 diabetes mellitus is the poor use of endogenous insulin and diagnosed through lifestyle approach. There are many risk factors that lead to exacerbation of diabetes, which include sedentary behaviors and eating habits. Dateria et al. 2020 stated that people hospitalized with both an elevated blood glucose of greater than 7.8 millimole per liter and an hemoglobin A1C of 6.5% or higher can be identified as having diabetes.
We will now talk about diabetes specifically in the Philippines. Diabetes mellitus accounts for 3.23% of the total DALYs in the Philippines. It is said that Asia will see the highest increase in incidence of diabetes by 2025. The mean hemoglobin A1C in 2003 and 2008 are 8.9% and 8.03% respectively. But it is important to note that the target goal by the American Diabetes Association is less than 7%. According to Adoption Nutrition, the Filipino diet is higher in fat, saturated fat, and cholesterol compared to other Asian countries' diets. Overall, there are several risk factors at play that would contribute to the incidence of diabetes in the Philippines.
Role of nursing towards diabetes management. It is fundamental for nurses to establish support and a plan of care when helping patients with diabetes management. Interventions such as the ones listed will help a patient through a holistic approach. These include providing education on a global health challenge like diabetes to help the patient act against it, educating the patient during their stay in the healthcare setting, creating an appropriate plan of care that helps the patient through a patient-oriented approach, which includes exercise and diet regimens. For instance, the nurse can also take vital signs during their shifts and compare them to the patient's baseline to seek critical information to report back to the healthcare provider. The nurse can also educate the patient on how these lifestyle modifications are vital to the prevention of fully fledged diabetes. And finally, the nurses can work with other members of the interdisciplinary team, such as physiotherapists and dietitians, to establish a plan of care that is centered to the patient and ensures that everything is accessible to them.
For our class activity, what are two types of upstream and downstream approaches for the management of diabetes? Provide a reasoning for each approach.
Thank you for listening, and please let us know if you have any questions. The end.